5 things to remember about Mycoplasma hyorhinis. So it is a mycoplasma. It is a commensal bacteria of the upper respiratory tract, meaning that a lot of pigs carry the bacteria in their tonsils, and the piglets get infected from the sow really early in life. So the sow sheds the bacteria in her oral nasal fluids, and that's the way the piglets get infected. They can also get infected from each other later on in life. So the disease usually happens in nursery age pigs, so between 3 and 10 weeks of age, and the clinical signs we will see is piglets that are not looking good, they're losing weight, they have a rough haircut, and they also are showing signs of lameness. So they're pigs that will not want to stand up and that are not going to eat or drink, and hence why they are losing weight. Rarely we will see some sign of coughing. We can also see some mortality with Mycoplasma hyorhinis. We will see a severe polyposerositis with a lot of fibrous adhesions. So a lot of fibrin, and we will see the lungs that get attached to the rib cage or to the heart, a lot of fibrin around the pericardium, and in the abdomen, fibrin around the liver, the spleen, and the intestine, making it hard for the pig to move around. We will see swollen joints as well due to the arthritis, and when we cut the joints open, we will see a serohemorrhagic fluid. So to diagnose Mycoplasma hyorhinis, we want to do a culture or a PCR of the fibrin swabs. So take a swab and get it like deep into the rib cage or in the abdomen and try to get some of that fibrin out, and you send that to the veterinary diagnostic lab. However, if you do swabs of the nasal cavity, this is inconclusive because remember that pigs can carry Mycoplasma hyorhinis in their tonsils for a very, very long time, so positive results would not mean anything. So we can treat pigs for Mycoplasma hyorhinis. However, we need to make sure we catch them early on in the infection. Once there is all of that fibrin, it's really hard to eliminate it. It's actually pretty much impossible. Treatments do not use beta-lactams because it's a mycoplasma. It does not have a cell wall, but broader spectrum antibiotics like maybe tetracyclines or macrolides can be used for mycoplasma.